If you or someone that you love suffers from snoring or sleep apnea, Charlotte Headache Center can help. You guys have some new technologies aside from the bulky CPAP machine.
Right. There have been some incredible advancements in sleep medicine in the last few years. And one of the interesting things that patients that are either patients that snore or patients that may have mild to moderate sleep apnea can now be treated with an alternative treatment besides the CPAP. So interestingly, many patients that have been diagnosed with sleep apnea or are chronic snoring patients have been prescribed a CPAP machine. Well, some people like it and some don't. It's bulky, it's obtrusive, it makes noise at night, it can disturb your partner while you're sleeping. There are quite a number of patients that are prescribed CPAP and then decide for whatever reason, I'm just not going to use this device. So American Academy of Sleep Medicine recently has advocated that a good alternative therapy for these patients is what's called a mandibular advancement appliance. So this is an appliance that fits in the mouth. It snaps on the upper and lower teeth, and then there are straps that allow it to pull the mandible forward. And so what this does is it opens the airway so that those patients where they were once making that vibrating, snoring sound, guess what? The snoring goes away. And in the process of opening the airway, these patients are breathing better at night, so they can get the oxygen in that they need, and that they can wake up feeling more rested and less tired than they did before they wore the appliance.
And a mouthpiece appliance sounds convenient, portable, easy to take with you.
It is, and that's the great thing. So busy patients that travel a lot, carrying a CPAP machine is just not convenient. But the oral appliance is quite small, it's easy to clean, easy to keep up with, and easy to pack in your travel case when you're headed out of town.
So sleepless spouses who sleep next to snorers are thanking you today.
Right. Interestingly, one of the most common category of patients that we see are men that were referred to us by their wives.
So, I believe it.
Wives are online doing research and discover, wait a minute, maybe this is something that could help my husband. You know, I'm constantly having to tell him to turn over and try to get him to be quiet during the night, but this is really an effective solution it's easy to fabricate, and patients can get comfortable in them pretty quickly, and they really do seem to like the appliance once they get comfortable with it.
I can see this can improve a lot of lives.
Absolutely.
Dr. Harrell, thanks for your time today. We've learned a lot of helpful information today, and I hope you at home learned something as well.